When you were going to medical school, how much information did they talk to you about nutrition?
It's a joke. They don't teach you anything. They claim that nutrition is bundled in with biochemistry, but it's not. And so they come out there thinking that they've learned nutrition, but they really don't know anything. Conventional medicine is really all about generating billing codes. They don't talk about outcomes. Nobody talks about outcomes, because if you talk about outcomes, then somebody would bring in the vegan diet and they would have the best outcomes. So they always talk about efficiency, productivity, and they just keep working the doctors more and more. And that's also why doctors are always in a hurry. If you cure a patient, you lose a customer. So what I'm trying to say is it's all about productivity and numbers. You know, I always wanted to be a great doctor, and I was a super intense, dedicated student, first in my class in med school and all this stuff. And so it's sort of like, here I am, I've gotten to be my older years, my kids are grown up, I sit around reading, I'm like, holy crap, all of the medical textbooks are completely wrong. All the internal medicine subspecialty books, they're a joke. I've studied medicine upside down, backwards, and forwards. There's nothing like the low-fat vegan diet.
Hello, everybody. Welcome to the show. I'm so excited about my next guest. This is Dr. Peter Rogers. Peter, welcome to the show.
Thank you. Hi.
So, Peter, before we get started, could you briefly tell the audience a little about yourself?
Yeah, hi, I'm Pete Rogers. I work as a doctor in clinical medicine, conventional medicine. I started out as an imaging-guided surgeon, and I was pretty happy with that, but I thought I could be an imaging-guided surgeon of the brain, endovascular brain surgeon. I started doing a fellowship in that. I initially switched to just diagnostic neuroradiology, but anyways, I was working 2 shifts simultaneously, had a baby at home with the wife, wrote a textbook that year, and I got real fat, like 220 pounds, which is a lot for me because I'm only 5'9". So then I'm like, oh my God, all my conventional doc buddies had no useful advice, none, take a statin. So then I started studying nutrition, and I moved towards becoming a vegetarian, which I've been about 20 years, but then I became a vegan about 6 years.
Wonderful, wonderful. So let me ask you, when you were going to medical school, how much information did they talk to you about nutrition?
It's a joke. They don't teach you anything. They claim that nutrition is bundled in with biochemistry, but it's not. And so they come out there thinking that they've learned nutrition, but they really don't know anything.
Sure. Okay, so besides your weight, besides you being overweight, what else did it for you that made you realize, look, I got to change my diet? Or was it strictly that you got to lose weight?
Yeah, well, I was afraid that I was going to be headed towards all the diseases. All the patients have the same disease. These are the Western diseases. They get fat, then they get hypertensive, then they're pre-diabetic with a fatty liver, and then they're diabetic. And those are the gateway diseases that lead to everything else bad. Make them impotent. Typically, they're impotent before they got coronary artery disease. Then they got coronary artery disease. They got cerebral vascular disease. By the time they're late 50s, early 60s, almost every single one of them is fat, sick, and stupid. When I say stupid, I mean they're cognitively slow. They can still find their way home, but they've lost that vitality and nuance. And so, you know, I'm like, oh my God, I'm heading down the same path. You know, like I thought I was a good doctor. How come I'm heading down the same path? Is this inevitable? And then when I started learning all this nutrition, I'm like, look at all these vegans. They're skinny. They got no hypertension. They got no diabetes.
So what did your doctor friends say when you went on this vegan diet?
Well, at first, they all think it's a big joke. They think that it's irrelevant. But then I'm like, they didn't really get it. Then my total cholesterol, you know, dropped really low in a good way. You know, it's been ever since then, it's been between about 90 to 140. Okay, before that, it was between like 180, 200. And I just keep seeing, you know, there's no cure. When they call hypertension, diabetes, coronary artery disease, chronic diseases in conventional medicine, chronic means never cured, 0 cure rate. Then you look at low-fat vegan diet, they cure about 100% of these patients. Coronary artery disease, diabetes, if you catch it early enough, and hypertension. So I'm like, wow, this is where it's at. How come there isn't more interest in it?
Sure. And give us an idea of what your diet is like now.
Okay, so I eat about 60% of my calories from starch, about 35 to 40% from fruits, and I'll eat a little bit of veggies, maybe about 5% of calories from veggies. It'll vary, sometimes more like 50% starch, a little more fruit.
Is there one particular popular way of eating a vegan diet that you resonate with the closest to?
Well, you know, some of it's a logistical thing. So where I live up near the Chicago area, it's kind of cold. Fruits aren't as readily available. They're a little more expensive. You know, they don't store as well. A starch, you can just have a big box of it and it'll sit there for months and months without any. So starch is cheap and it's convenient. So I eat a lot of starch, but I also really like fruits. You know, I exercise a decent amount too. So I think that helps make it all work. But I'm pretty happy with it. I'm 60 years old. I got real good physical fitness, strength, mental acuity and stuff. So I'm very happy with this because I felt myself getting sick in my 30s, and now I feel great.
Sure. How old did you say you are?
I'm now 60 years old.
Okay. So you said you eat a little amount of vegetables, you eat a good amount of fruit and starch. Uh, Being in Chicago, do you buy most of your food from the store or do you grow anything?
Yeah, I just buy everything, and I'll eat a lot of white rice, a lot of potatoes, a lot of sweet potatoes, a lot of beans. I especially like the lentils because they're only 3% of calories from fat. Black beans are about 4% of calories from fat. Garbanzo's about 13% of calories from fat. But I'll have that. Beans got that long satisfaction of hunger effect because I typically eat an OMAD diet, one meal a day,
Oh,
and
you
so
do?
I
Okay.
yeah, so I like something to satisfy my hunger, and I don't have any problem with it. But it just works well because I work all day and then I come home, I eat at night. It's a little bit like the Roman soldier diet. They work all day, and then when it's night, campfire, big dinner, go back to sleep.
Okay, I got several questions. The first one is what you're doing is wonderful, by the way. I mean, you've come so far more than where you were. What's your weight now, by the way?
Oh, now I weigh 160.
Okay, great. Wonderful. So, like when you make these choices, some people get deep into it, some people are just fine where they're at. But like white rice over brown rice, do you go that deep into it or do you just prefer
Yeah,
white rice because and do you think it's healthier? What's your opinion about that?
yeah, the reason why I prefer white rice is that it's less likely, number one, to have arsenic in it. Number two, because they've removed some of the fat, it's less likely to go rancid. It stores better. It tastes good. It's convenient. But I think the big driving force why I went with white rice was to avoid the arsenic. And I also don't buy it from southeastern United States where they used to have a lot of arsenic type pesticides for boll weevils when they were growing cotton because it was a textile product. They'd spray more of it, and it takes decades to come out of the soil. So that's why I ended up on white rice.
Why not? What about organic brown rice? Wouldn't that come without the arsenic?
Well, I don't think arsenic. I don't know if that necessarily relates to the arsenic. I'm not aware of that relating to the arsenic,
That
so I
would be
don't know.
from the pesticide use, the arsenic, right?
Yeah, but it's in the soil in the southeastern United States, for example. And I don't know, that many other ways to buy it. If there was a great way that I could buy brown rice that it didn't have any arsenic issue, yeah, I'd be fine with it.
Well, what about grains like millet and quinoa? Aren't they more healthier than rice to begin with?
They're decent, but quinoa kind of reminds me of oatmeal. I would call it a wet grain, meaning that it gets real wet when you boil it. That's the only way I know how to cook it. And I don't like to eat something as wet at night because I'm more likely to have to wake up the void.
Sure. Millet is wonderful. When I used to eat grains, I haven't had grains in 30 years, but I make it for my children. It is so delicious. So okay, so you're on OMAD, one meal a day. When did that start?
Well, it just started because I have to work more and more. The way they get you in conventional medicine is they get you hired in for a job, and then they just say, well, we'd like you to do a little more work. And they'll always compare you to some place somewhere else and saying, the docs over there are doing, 50 cases a day. You're only doing 40 cases a day. Don't you think you could do 50? And you're like, oh, God. So now you're doing 50. All of a sudden, a couple years later, the docs over there are doing 60 cases a day. Don't you think you could do 60? So they keep on kind of pushing you further, and you end up having to work more and more. That's how they get conventional docs, because conventional medicine is really all about generating billing codes. They don't talk about outcomes. Nobody talks about outcomes because if you talk about outcomes, then somebody would bring in the vegan diet and they would have the best outcomes. So they always talk about efficiency, productivity, and they just keep working the doctors more and more. And that's also why doctors are always in a hurry. I heard it called clock medicine because they always have to get their billing codes. Every clinic, whatever it is, every hospital has a bean counter, and the bean counter is always like, are all my docs getting their numbers for the day? And so nobody gives a rat's tail about cures. It's all about match the ill to the pill and send the bill. It's how you make money in medicine. And also, if you cure a patient, you lose a customer. So what I'm trying to say is it's all about productivity and numbers, and you end up working long hours. Most docs do. And so, you need to make a little time to sleep. If I eat twice a day, it takes more of my time to do it. Plus, that time in the morning is kind of precious. I want to sleep in. I'm real busy all day. I don't have time really to eat lunch.
Sure. How many hours do you normally sleep per night?
I try. In a perfect world, I get 7 or 8. A lot of times I only get 6.
Okay. So I wrote a book called The Daylight Diet, and it talks about how digestion doesn't work well when we eat late at night or eating before going to sleep. And I've interviewed people that are very knowledgeable about nutrition, but for the same reasons you say, because of schedule wise, they even know that, but they say, oh, I don't have a choice because of these situations. Uh, do you think it's better to eat in a day? You just don't have the
Well,
time?
I think maybe in a perfect world, it would be nice to eat for lunch. Okay. I do a lot of academic work, and I've written a bunch of books, and you're smartest when you first wake up in the morning because your brain cleans itself overnight through what's called the glymphatic system. Your brain can't go offline in the daytime, but it can go offline at night while you're asleep because you don't have to maintain precise environmental ionic milieu, if you will, around the neurons. So what I'm saying is, as soon as I wake up in the morning, I like to do all my challenging intellectual academic stuff. And you get this spurt of cortisol when you first wake up in the morning anyways. And I think the way it works is, when does an animal need to be smart? An animal needs to be smart when it's hungry. So you get that burst of cortisol, maintain your blood glucose. You're supposed to go out and find some food. Whereas later in the afternoon, your brain starts slowing down. I think your IQ sort of drifts down as the day goes on. So that would be the perfect time in the afternoon. But usually on a regular work day, I'm at work and I don't really got time to eat much. I'll sometimes guzzle down some beet juice, for example. But I don't really have time to eat a full meal. I wish I did. I wish I sort of could work from home, but I can't. So that's kind of where I'm at.
Don't they give you a lunch hour or lunch 15 minutes or something?
It's sort of fake though, because let's say you've got to generate 70 billing codes by the end of the day. If you take time for lunch, that just means you stay that much later. I don't want to take a full lunch.
Sure. Okay, so when you are eating and you're eating, what's your window? Like, how long does your meal last and how big is it? Because I know people that do one OMAD and some of them do just a smaller meal. Some of them do it, they combine all three of their meals in one meal, and it's so.
I eat a pretty big meal. I typically eat the starch first, and then I follow it with the fruits, and I follow it with the veggies. If I was trying to lose weight, I might do it differently. Eat the veggies first, but my weight's pretty good. I weigh the same I did when I was in high school, 160 pounds.
So you eat the starch first, like the rice or something first?
Yeah, like rice and beans or
and
potatoes.
Then you eat the fruit.
Potatoes.
Now that doesn't go along with the conventional way of food combining. But so why is there a reason why you eat it in that order?
Well, one of the reasons is that when I eat starch, I get full. I don't want to eat that much starch. It's almost like somehow my brain says, okay, that's enough, and I stop. Versus it's not like that with fruit. With fruit, I'll eat however much there is. I could eat, 20 ounces of blueberries. I could eat 5 apples. I could easily eat 15, 20 apples. So by eating the starch first, I always have more room for the fruit. Even though I'm full from starch, I've always got more room for the fruits. So it just works for me. That's why I've gone on that path.
Sure. And so how long does your eating window usually last? What time do you usually start and usually end?
Well, it'll take a couple hours a lot of times because I have to go upstairs and downstairs. It was sort of like, originally with the wife, we had this big discussion, who's going to get what bedroom where. And the way it all works out is I'm basically not allowed to do anything on the ground floor except go in the kitchen to get some food. And the wife's all proud of herself. She got the big territorial victory. But you know what? It actually worked out well for me because I'm constantly going up and down the stairs all day. I get a lot of exercise. And so anyways, I have to constantly go up and down the stairs to get my food and come back to a basement office that I have. So I get a lot of exercise from that. And I'll often watch YouTube videos. Sometimes I'll read a paper or something while I'm eating. But it takes a couple of hours for me to eat dinner. Typically, I've come home from work and, I'm sort of like decompressing, and then I'll eat it and watch a couple of YouTube videos or read a paper on the computer. Most of the time I watch YouTube videos. And but it's a couple hours that the whole process transpires over. And, it's kind of pleasant. I'm watching the videos. I'm learning something.
Sure. And does your wife eat at the same time and same way you do? Or
no, she doesn't. Yeah, she's sort of old school. Most people, they stuck with their old high meat diets. And I've aged way, way, way better than her. It's just a fact, okay? Because a lot of people, they're addicted to that. And I think with men are scared of becoming impotent, okay? Men also, we see a lot of our friends. They've had myocardial infarctions. They got a lot of problems. Women don't start having the same problems as men until about 10 years later. So they're not as afraid of it. And then it's not until later that they start becoming more concerned and aware of coronary artery disease and all that.
Sure. And now I know you're doing this for health, and I also know you love animals, but the main reason you seem to be doing this is for your health. So I find when people do this for health reasons first, they can survive with a partner who doesn't eat a vegan diet. But when people are doing it for animal rights reasons, then that's a really a recipe for disaster from a relationship standpoint. How do you and your wife do it? Do you get along fine and you just make food a secondary thing?
Well, the food is sort of a separate issue. And kind of like when I married my wife, she was super beautiful. Okay. So she was a little bit stuck up compared to me in terms of her looks compared to my looks. But over time, I've aged so much better than her that I look better than her. So I find that a little bit funny. Okay. That's a little bit of a joke in our house. All right. But, we don't argue too much about the food because in a sense, she's in the majority. The kids eat meat and they eat, and everybody gradually starts moving in my direction because they see I'm doing so well. But they don't start out that way. They all started out thinking I was a little bit crazy and that I'm overdoing it and I'm obsessive compulsive. And my wife told me, you're like an effing robot. You'd eat the grass if you thought it would make you healthy. And they kind of like label me as a little bit, Asperger autistic and stuff. And I'm just like, you know what? It works. I feel great. My numbers are perfect. I'm strong. I got a lot of energy, a lot of endurance. Everything's good. It's the way I want it to be.
Great. Well, speaking of that, do you get your blood tested on a regular basis?
I do get my blood tested for a couple of things. I keep track of my cholesterol. Usually it's between about 90 to 140, which is where I want it. My goal is to stay below total cholesterol 150. I check my serum ferritin, which in the past was up around like 280 or something. And that's because when I was younger, I didn't know any better. I used to eat those iron fortified Raisin Brans to be strong like Popeye. But now that I realize it's nice to have your iron low, I like to keep my serum ferritin between about 30 to 80. I've read papers on that. I think you're more prone to oxidative stress if you have elevated serum ferritin. What else do I check? I check my B12. I try to keep that between ideally about 500 to 900. Those are probably the main things I concern myself with. My blood pressure.
Sure. From a cholesterol standpoint, I heard the number doesn't matter as much as the ratio. Is that correct or incorrect from your view?
I don't think so. I think the most important thing is the total cholesterol number. There's a lot of people gone by that for a long time. Like the Framingham study said, you keep it below 150, you're unlikely to have a cardiac event. Esselstyn also went by keeping it below 150. Pritikin went by keeping it below 140. McDougall, I think, was 150. I'm not exactly sure, but I'm pretty sure McDougall was 150 guy. So keeping your total cholesterol below that usually keeps you out of trouble for cardiac reasons. If you can do that with just diet. Now, I'm not talking about doing that with medicine. I'm talking about doing it with diet. So
that
in
works. The old days, wasn't it like the number much higher? The standard number in the old days?
Oh, yeah.
Much higher.
They talk about a standard normal cholesterol of 200. So they'll tell the patient you're normal if you're below 200, but that's normed based on a high cardiac risk population. Yeah, and the reason is because LDL cholesterol is a bridging molecule. It has a positive charge on its outer surface. RBCs have a negative charge, zeta potential. It sticks them together. So it clumps the red blood cells. It predisposes to a clot. The other thing people don't know about atherosclerosis is a blood clot. The guy who pioneered this theory was Gregory Sloop, and he's right. I've studied atherosclerosis for decades. Atherosclerosis is a blood clot. Once you understand that, everything else will start to make sense.
Well, if somebody has, let's say, high LDL, but their lipoprotein A is low and they don't have the big particles in their blood, is that not as much a concern as if somebody's lipoprotein B and little a is higher?
It's better to have it lower. I know some people congenitally have higher amounts. I've heard some interesting things about a couple different people who have lowered their LPAs. They say you can't lower it, but that's not true. I've heard of a bunch of people now lowering it by, eating these low-fat plant-based diets or even fasting.
That being said, you mentioned B12 and a few other things. So on this vegan diet, do you take supplements?
No, I personally don't take any supplements. The only thing I take is methylcobalamin, and I get the one with the fewest ingredients. I actually learned something very interesting about B12s lately because I went to the store. A lot of the B12 supplements, they sweeten them with stevia. And I think that's a bad idea. Stevia has got a pretty strong association with infertility. So that's been known since the 1960s. And
yeah. So I'm in New York, we call it stevia. Stevia. Well, stevia. But, there's different types. I've done research on this. There's the liquid stevia or stevia. There's the white stevia. What I take and use and love is a green stevia that has so many medicinal properties to it, and it does sweeten stuff, but it's not concentrated at all. It's just like the leaf ground up. It's amazing. Yeah. So no supplements, but you do take B12, you're saying, yes?
Yep. That's the only one.
What B12 do you take?
I take a methylcobalamin. I don't know the brand name, but I do know it's got very few ingredients. I intentionally get the one with like the fewest ingredients. I like methylcobalamin. I don't like cyano. I worry about what the heck if you're going to accumulate cyano in your body. So that's why I take methyl. I've heard hydroxy might be okay, but I don't have any experience with it.
Okay. So now, one of the things I've seen a video about you make and talk about is Are you concerned at all, or have you tested your omega 3s?
Nah, I'm not worried about it. I think it's a non-issue.
Okay, so do you think as a vegan you get your enough omega 3 from things like flax seeds and chia seeds, or do you not even
I don't
know?
even eat any seeds. I just don't worry about it. I had read, McDougall thinks you don't need to supplement at all. I read way back. I read through all the Kempner stuff. I read through all the Pritikin stuff, and they were of the impression that it was a non-issue. And like the paper Pritikin, it was one paper by an author named Winitz from 1970. They fed patients less than 1% of calories from fat on these controlled diets. Winitz for 6 months. They fed them only omega-6 fats, and the patients did very well. Another patient, the author's name was McKean. They did the same thing. They're feeding them only, it was 0.7% of calories from fat, and it was omega-6 fats. It was the precursor omega-6 fat, alpha linoleic, not alpha, it was just linoleic acid. And the patients did quite well. I actually think this supplementation stuff with omega-3s is quite overrated, especially with the EPA DHA, because my concern is you're feeding this big PUFA in there. EPA is isopentanoic acid. That's 5 double bonds. DHA is I think it's docosahexaenoic acid. The point being is 6 double bonds. The more double bonds you have, the more predisposition you have to lipid peroxidation. So you're going to be more inclined to rancidity. They put it in a radio-opaque container. You got to get in the fridge right away. Your body temperature is much higher than room temperature. So that would concern me, because when fats go rancid, they predispose to forming toxic aldehydes. So, I just don't see the benefit in it. Omega-3s came out as increasing the risk of atrial fibrillation. There's several papers on that. Omega-3s increase your predisposition to obesity. They increase your predisposition to diabetes. They increase your predisposition to atrial fibrillation. They're immunosuppressant, so they're going to increase your risk of cancer. Brasky's papers show they increase the risk of prostate cancer. Usually anything that increases prostate cancer increases breast cancer risk, even though I haven't seen the paper. In animal studies, they increase the risk of metastatic disease. So they're immunosuppressant. And so I have no interest in taking that.
Sure. What about the omega 3 blood test? Do you think that's accurate? Because some people say it's stored up in the tissue and the blood test isn't accurate because it measures the blood, but other people say it's 100% accurate. What's your opinion?
Well, I haven't specifically studied that test, because to me it sounds irrelevant. It sounds to me like just creating a mechanism to sell a drug. Because the way omega-3 is talked about as a supplement, it's basically being used as a drug. And every drug has side effects, and I don't think I'm deficient in it, so I think it's a non-issue.
Sure. Okay. And what percentage of your diet would you say consists of fat, and where do you get those fats from?
My percentage of fats is pretty low. I don't know the exact number, but I'm going to predict it's about 6 or 7% of my calories from fat. I think it's a non-issue. Like I said, Kempner was feeding his patients a remarkably low percentage of calories from fat. I don't remember what it was. I think it was in the ballpark of about 3%, 2.2% to 3%. His patients were doing fantastic. McDougall's, Esselstyn's diet, very low percentage of calories from fat. For example, white rice is only 1% of calories from fat. Potatoes, 1% of calories from fat. Sweet potatoes, 1% of calories from fat. Lentils, 3% of calories from fat. So those are really low-fat numbers. And I only eat low-fat fruits. And I intentionally want to keep low my fat intake. There's a guy by the name of David Blankenhorn. He did an atherosclerosis paper, and the conclusion he came to after testing all the different types of fats was you must reduce all types of fats. The lower your total dietary intake of fat, the more you can reverse atherosclerosis. And whatever fat you eat increases it. So,
Sure. Do you consume avocados?
no, I would never eat an avocado. I think
Really?
avocados are a bad idea, because they're like one of the most heavily sprayed with this new preservative called apeel. And I looked up
Appeal, yeah,
the data
appeal, yep.
sheets. Yeah, I looked up the Chem data sheets. People say, oh, well, it's got trans fats. What do you do? I'm not worried about the trans fats. I think it has acetonitrile or something, which is a form of like methyl cyanide or something. Now, it's not always in there, but it's allowed to be in there. And there were several other toxic things that were allowed to be in there. I think if I recall correctly, hexane, toluene and stuff. It had really bad, worrisome things about it. In addition, what's it marketed as? It's marketed as an antifungal to prevent mold, so you don't get mold growing on there. But you know what? Most of these antifungal things are mitochondrial inhibitors, in my experience of studying
Sure.
mitochondrial inhibitors. So I don't want a mitochondrial inhibitor. Mitochondrial inhibitors can potentially increase your risk of cancer, cognitive decline. For what?
Absolutely. So I grow my fruits and vegetables, and I grow avocados, and I have friends that grow avocados here in South Florida, and I know we don't use a peel, we don't spray it, and all these things. If you were able to get organic homegrown avocados, would you still not consume them, or would you be more open to it?
Well, in that context, it wouldn't be so big a deal. I mean, it's got a lot of fat in it. They are very high in fat. I think it's, like 80% or something like that. But so I'm not thrilled about the fat. But the only thing I really worried about, like, why would I not have guacamole or anything? It's because of that appeal stuff. You know,
Sure, sure. Okay. And so when it comes to nuts and seeds, do you consume a good amount of nuts and seeds or no?
No, I don't. I mean, Esselstyn doesn't allow the nuts or seeds, and I'm not worried about it. If it was a holiday or something, would I maybe have some? Sure. I found that, I used to think, oh, I got to have Brazil nut to get selenium, but I went through my numbers and stuff, and you got to get plenty of selenium from other foods. So I don't need them ever. So I don't seek out nuts, but because I don't want the extra fat, but I don't see them as that big of a deal as long as the person doesn't eat a lot of them.
Are you at all concerned with the quality of the fruits and vegetables in the stores? Because as a grower, I used to love to get fruit from the store, but now I realize how green and unripe they picked it, and I realize the only fruits that ripen off the tree are avocados and bananas properly, and everything else is just picked way too green. Do you think about that at all, or do you just do the best you can do and not worry about
I
it?
don't usually think about it too much, but I think you have a good point. I do wish there were more organic growers, more local growers. That's certainly one of the advantages. You live in a really warm climate. And I have seen something interesting. I've seen a lot of these people who are multi-decade survivors of cancer, and they go move or live in these warm climates, and they eat tons of, produce, fruits and vegetables all the time. But, I live up in the Midwest, and it's cold in the winter. So I wish I had the option, that I had a good friend who grew stuff organically without all these chemicals, but I don't.
But you do. I mean, I have friends and myself even in the summertime, but I even have friends in the wintertime. They ship what avocados, persimmons, starfruit, they ship all of it in the mail and it's not that expensive. And everyone has an option these days. Unlike the old days, it was a big process, but now you press one button on the internet, the next thing you know, it's at your door 3 days later. It's pretty amazing. And you're getting like really good food. It's amazing. And also what I would do is if I was I don't know. I know persimmons grow in cold climates in the wintertime, but cherries and apples, like up in upstate New York, they grow apples. I'd make friends with those apple farmers and visit them every weekend and get a box of apples. And now I'm getting fresh produce right off the tree practically. It's everyone, it's just amazing. I just see such a big difference between what's shipped to the store and then what we can get from the farm. And it's not the same. The middlemen, like you said, they add all that garbage to it and they pick it green. It's amazing. So that's really wonderful what you're doing and how you're helping people. So what are you just a doctor who's eating healthy, or is there something you do? Do you help your clients, like tell them, look, your patients, I know how you can get better. You could take this medicine if you want to, but I recommend this diet instead, or do you just not say anything to anyone because your job's in danger?
Well, the way it works is lots of doctors come to me and they talk to me, and they all want my advice on what they should eat. And they got family members who are sick. And so I do whatever I can to help them. But conventional medicine, I make my money as a radiologist. So as a neuroradiologist, reading brain MRIs and CTs and spines. I also do a lot of procedures. I still do a little imaging guided surgery. I'll do tons of biopsies, spinal taps, myelograms, all that kind of stuff. But my money comes from reading the films. So the other stuff is just for fun. It was sort of that, I always wanted to be a great doctor, and I was a super intense, dedicated student, first in my class in med school and all this stuff. And so it's sort of like, here I am, I've gotten to be my older years, my kids are grown up, I sit around reading, I'm like, holy crap, all of the medical textbooks are completely wrong. All the internal medicine subspecialty books, they're a joke. Okay. And so I said, I need to write. So I wrote some books. I have no marketing skills or whatever. So almost nobody reads my books, but it's so obvious that I'm right. It's not even funny. Like, let's just talk about hypertension, because they're all the same on almost every disease. And you read it and it goes, well, hypertension, the cause is largely unknown. And it seems to be, obviously associated with aging. It might be part genetic, maybe indirectly, rarely related to an infection, sometimes due to socioeconomic disparity. And it sounds real thoughtful and well-reasoned. It's a bunch of BS, okay? In Kenya, 1929, the Lancet Journal, 1,800 consecutive admissions, they checked their blood pressure in a Kenyan population eating a plant-based diet. You know how much hypertension there was? Zero. So that's what I'm saying. It's the same BS every page. They always say that that's the cause of every disease. Nobody knows. You know the old joke, when the disease is idiopathic, it means the doctor's an idiot and the patient's pathetic. People go low fat, low sodium vegan. They cure these diseases. So it's like, wow, there's actually something that can cure you. And also I see all these sad, really sick people. And it's like, we have nothing really to offer them. And I'm like, holy crap, these cures, all this knowledge is sitting right here. They'll never invite you to conventional medicine because they would lose money if the patients knew this. And then there's all this confusion. I think all these paleo, keto, carnivore, low carbers, they get sponsored. And so they'll have millions of views on their videos, but it's a bunch of nonsense.
Yes. Have you heard of the SOS diet? No salt, oil, or sugar that's extracted.
Yeah, I've heard of that.
What's your opinion about that?
Well, I think it's a step in the right direction, reducing salt, oil, and sugar. I would avoid those things. I don't add any salt. I think a little bit of sodium sprinkled on the outside of the food is not a big deal. Same thing, a little bit of sugar is not a big deal. I've heard those called minor poisons, but I think they're not bad, okay, because they get the people to eat the healthy food, and they're not that big of a deal. But I think the oils are a big deal. I recommend zero oil, not one drop. I think those are quite toxic. I study fats a lot, and so but I was very happy writing books. I've written like over 20 books, okay? And I was always a fantastic student, and I was really good at biochemistry. I considered being a biochemist, and I'm like, holy crap, this is what I should be doing. If I could get paid money, I would do this nutrition, telehealth stuff full time. But I can't get any money. And, I don't make any money from it at all. I just do it as a hobby. But I love this stuff because it's the most powerful thing in all of medicine. I've studied medicine upside down, backwards, and forwards. There's nothing like the low-fat vegan diet.
As a doctor, what's your opinion about the paleo diet?
It's just stupid.
Go ahead.
Yeah, fat is very damaging to the body. Excessive dietary fat. Number one, it sticks the red blood cells together, so you get thick blood. It increases blood viscosity. When you're pumping, why do we have a blood pressure? To pump blood to the top of our brain, our cerebral cortex. So if you're pumping thick blood, you have to pump at a higher pressure. So you're going to have hypertension. Hypertension is the number one risk factor for atherosclerosis because when it's pumped at a higher velocity and pressure, it hits the tissue in between the bifurcation, let's say the internal carotid, external carotid, and it bounces off of there. So there'll be an increased amount of turbulent flow and retrograde eddy flow. And that injures the arterial lining, and then you form a blood clot because you release your antithrombotic glycocalyx and you express prothrombotic molecules underneath it, like VCAM, vascular cell adhesion molecule, and you form a clot. And I'm a neuroradiologist. I look at CT angiograms of the brain every day, okay? And I can tell you always find the clot right in the same spot at the origin of the internal carotid artery, right at the bifurcation. Hypertension does that. You look at Asian atherosclerosis. Japanese in the 1960s, they're smoking like chimneys and they're putting like 12, 14 grams of salt on their food. They get all this intracranial atherosclerosis. Whereas the Westerners who eat primarily a fat diet, they'd especially get coronary artery disease. If you do both, you get both. But anyways, what I'm saying is all you got to do is avoid the high-fat meals, don't smoke cigarettes, and you don't get this stuff. And
as a doctor, what's your opinion about the carnivore diet?
Oh, it's totally stupid. There's no fiber in animal food. So when you don't have any fiber, you're going to be predisposed to leaky gut. Once you got leaky gut, the bacterial endotoxins can get across that gut lining, okay? That's like LPS from the gram-negative bacteria, LTA from the gram-positive bacteria. And now those bacterial endotoxins, they get in the blood and they cause something called amyloid clotting. The secondary protein structure is alpha helix, and it changes the beta-pleated sheet, which is flat. Alpha helix is like a cylinder, so they don't stick together, of fibrinogen, the clotting protein. Beta-pleated sheet is like a deck of playing cards. They'll stick together and form a big molecule, then precipitates out of solution. Douglas Kell from England and Etheresia Pretorius from South Africa are the big writers on this. They deserve a Nobel Prize, but they'll never get it. They want to keep it a secret. Okay, so when a protein changes from alpha helix to beta-pleated sheet, that's called an amyloid clot. And I actually think that's one of the secrets of cognitive decline, that these little clots are plugging up small capillaries and arterioles in the heart and the brain. And so the only way you're going to avoid that is don't have leaky gut. And how are you going to not have leaky gut? Eat your adequate fiber and avoid things that predispose to leaky gut. Non-steroidal anti-inflammatory drugs, the fluoride in the water, you got to filter your water, the chlorine in the water, the oils will do it, those sorts of things. So you're screwed in multiple ways. You're predisposed to blood sludge or rouleau formation. We just talked about that. You're predisposed to leaky gut amyloid clotting. You're also predisposed to something, the fat in the blood causes the neutrophils to release myeloperoxidase, MPO, and that also is damaging to the arterial lining. Okay, it goes on and on. You get increased TMAO. You get increased hypertension. It's often flavored with salt. The salt's a vasoconstrictor. So now you're pumping thick blood through a constricted system. you're going to have more hypertension, meaning more atherosclerosis. It's all bad. It just goes on and on. No dietary fiber. You're predisposed to colon cancer. Different amino acid composition, more methionine, more leucine. Those activate mTOR, mammalian target of rapamycin. It's like a building contractor sensing that it has all its materials available before it tells the cell to replicate. The rate limiting step is leucine. So now you're going to have all that extra leucine, methionine. You're replicating your cells faster, meaning you're predisposing yourself to accelerated cancer growth and accelerated aging.
Sure. How much fruit did you say was in your diet?
I eat
What
about 35%, sometimes 40% of my calories from fruit.
Okay. Some people say that the fruit, the sugar in the fruit is just as bad as like high fructose corn syrup because the body doesn't know the difference and fructose is fructose. Other people say it completely makes a difference because when it's whole foods, it doesn't affect the body the same way as it's extracted like in corn syrup. What's your opinion?
Yeah, that's what I think. I think fruits are a healthy thing. I think it helps if you exercise more because I know a lot of people will talk about Dr. McDougall. Okay, and so Dr. McDougall, he is like Mr. Starch. He says you should eat 90% of your calories from starch and only 5% from fruits and 5% from veggies. But I think he's primarily dealing with a lot of older people that come to him quite sick already. Versus if you're a younger person, you exercise a lot. I got great labs. I feel fantastic. So it's pleasant to eat a lot of fruit. And I've seen tons of people eat a lot of fruit and they tend to be very healthy. There's all these triathletes, fruitarians and stuff going around looking really good and really fit. They're eating lots of fruits. And so I think it works. I actually think the reason why we have color vision is to see when fruits are ripe in nature. That seems my best guess for it. So then getting back to this high fructose corn syrup. High fructose corn syrup is different than the sugar in a fruit in the sense that it tends to often be 65% fructose. Fructose is sweeter than the glucose. And they'll often eat it in a bolus form, let's say like a sweetened drink, if you will, where there's no fiber, and so it's very rapidly absorbed into your body. Fructose is different than glucose. It goes almost entirely to the liver, and then it's taken up in the liver, and fructose enters glycolysis not at the beginning like glucose, where it's regulated and only runs if it needs to. It enters in the middle at the 3-carbon phase instead of the 6-carbon phase, and it rapidly gets converted through the second half of glycolysis because there's no regulatory step into pyruvate. And the liver's kind of like, hey, we don't need this. What are we going to do with it? Just make it into fat. So large amounts of fructose, especially when it comes in as a bolus with no fiber to slow it down, that predisposes to fatty liver. And Lustig is sort of the famous guy from California. His lecture was The Bitter Truth about sugar. And he claims that, it's the biggest disaster. I think, yes, it's bad in the context of high fructose corn syrup. Plus, that's often contaminated by mercury, which is also kind of funny because the food companies would say high fructose corn syrup, it's a preservative. And they don't say it's because of the contamination by mercury, but that's what the reason was. And mercury is a very toxic substance. It's neurotoxic as well. So the bottom line, I think, is if you're eating it in the context of processed foods, it does predispose to obesity and to hypertension. It elevates uric acid, so that predisposes to insulin resistance. Fatty liver is sort of like diabetes of the liver. So I do think I don't eat anything with high fructose corn syrup in it. But fruits, I think, they're made for us, and they got the fiber in them. They got a lot of nutrients with them, a lot of antioxidant vitamins, vitamin C, and whatnot.
So as long as it's connected to the fiber in the fruit, then you think it's okay.
Yeah, I believe that people do. Everything I've seen shows me that they do really well. So that's kind of what I'm saying too. And if you're still exercising and moving around, but I can tell you, I know McDougall, and he's a great nutrition expert. He thinks you got to watch out these old people. I think there are people who are not exercising, and he thinks in them they're fat, and he's got to really reduce their dietary lipids in a hurry. So it's sort of a different patient population.
Sure. Now, there's fruits that I grow. I'm a fruit grower, and there's a family of fruits called the Annona family, like soursops and cherimoys and things like this. And there's supposedly a neurotoxin in these things. It's also in pawpaw. And it's a neurotoxin in these fruits that studies have shown they could lead to Parkinson's and things like this. Have you ever heard about something like this?
I don't have any experience with that.
Okay, because they say if you eat the skin or it's in the seeds, but some people say it's in the fruit, and if you eat a lot of the fruit. But another doctor I interviewed said he got rid of all his trees that had this fruit because he was scared, and he heard that if you only eat one of them or two of them, it could be an issue. So it's something that you'd be the perfect person to ask, but you haven't heard anything about it. So
no, yeah, but I wouldn't need it though. Somebody told me it caused Parkinson. I would try to look it up and see if that was really true. But if it was, I would avoid it.
Well, I'll text you the study or the topic, and maybe since you love studying, you can look it up and tell me what you think. So when you're doing these readings of the images of the of the brain and so on. And do you ever, I'm sure you do, look at people with Alzheimer's and dementia and things like this. And as you're looking at their images, do you ever question on them or find out about how their diet and lifestyle has been throughout their life?
Well, yeah, I did a lot of things. I kind of had this idea ever since I was young. I wanted to be a great doctor, and I was always pushing myself. And I think a lot of people were quite annoyed with me. But one of the things that came out of it is for many, many years, I've run the neuroradiology imaging conference at the hospitals where I've worked. And I go through all the cases, and I would systematically look at the demented brains and say, why is this guy demented? And what I found from looking at over 1,000 cases is almost every single one of them, like at least 90%, they're diabetic and hypertensive. Okay. And then another 5% are only diabetic or only hypertensive. But I think a lot of times that's because it's not really in the chart. Almost all of them that. And almost all of them have at least one cataract surgery and they got poor dentition. All of those things go together. I think the eyes tend to go, a little bit before the brain, if you will. And then the other thing, too, that I noticed, like I said earlier, that all the medical books in conventional medicine for internal medicine subspecialties, they're all stupid. I think they're all a joke. And that kind of also motivated me that I need to write and study more. Like I'll give you an example on Alzheimer's. The more I started studying Alzheimer's, the more in my opinion, I think the whole thing's a big joke. You say, how could I say that? Okay, well, first of all, what's the physical exam finding? There is no physical exam finding. You don't put your stethoscope on a patient diagnosed Alzheimer's. What's the clinical historical question? There is none. Okay, so what's the imaging finding? They tell me you look at the brain, you see parietal, convexity, medial temporal lobe atrophy. I almost never see that. I look at thousands of demented brains. So it's not a characteristic appearance on brain MRI or brain CT. Well, what about nuclear meta imaging? Well, you can have a little bit of amyloid accumulation, but guess what? You can get that in a so-called Alzheimer patient as well. What about autopsy? It turns out from the studies that I've read and heard that they'll often see a lot of amyloid plaques, senile plaques, extracellular, neurofibrillary tangles, intracellular in non-Alzheimer's patient and vice versa. Okay, healthy people have them. Alzheimer's, so-called Alzheimer's didn't. And what I'm trying to say is you can't diagnose the disease when the patient's alive. You can't effectively diagnose it when they're dead. And you've got no treatment. What is that? That sounds like BS, okay? They took a disease where they had perhaps a familial earlier genetic form and tried to extrapolate and saying that was sporadic. Everybody's got that, and I don't think that's true. So then I started reading all the other dementia theories. And the best one that makes it simplest to understand is the Jack Delatorre theory, guy out of Texas, PhD. He tied off the carotid artery in a mouse. And he found that middle-aged and older mice, they'd be demented 2 months later. Okay, he did an autopsy on them, expecting a big stroke on the side. He tied the carotid off, but it was just a shrunken brain, apoptotic, atrophic brain. And I'm like, gee, that makes sense. Because when I look at all these demented brains, almost all that's what I see is an atrophic brain. I sometimes see a lot of small strokes, sound strokes, or a big cortical stroke, but the vast majority, I just see a shrunken brain. And so that would be one side that he tied off. But then you start saying to that, well, is that really relevant? How many people got severe stenosis or occlusion from carotid atherosclerosis? Not that many, but guess what? How many people have hypertension and they overtreat it? Overtreated hypertension, mouse equivalent. You're like the mouse. You got chronic cerebral hypoperfusion, not enough blood going up there. And let's say you don't treat the hypertension. When you don't treat the hypertension, the high pressure is hitting all the bifurcation points. They cause atherosclerosis. So then you get diffuse atherosclerosis disease, a drop in oxygen delivery to the brain. Let's say you just get diabetes. You get diffuse diabetes, atherosclerosis, thickening of the capillary basement membrane, advanced glycation end product, thickening of that capillary basement membrane. You're still ending up with a mouse equivalent, decreased oxygen delivery to the tissue so the mitochondria can't have enough ATP production. So then you also got lots of people got AFib, atrial fibrillation. Lots of people got aortic regurgitation, aortic stenosis. These are all mouse equivalents. Okay, and I think probably the most common one would be overtreated hypertension. So that's Delatorre's. That's great. Chronic cerebral hypoperfusion. And then there were some other theories. I could go through those too. I actually came up with my own theory. I call it the Peter Rogers supply and demand theory. So what I mean is you got a baseline amount of metabolic activity in a neuron, and you have a baseline oxygen and glucose delivery. Well, if you take a stimulant like caffeine, cocaine, you ramp up that neuron's metabolic activity. And it also turns out a lot of these supplements can do it. Things like, I don't mean a lot of them, I mean things like aspartame. Aspartame is an excitotoxin. It ramps up the metabolic activity. Anything that increases the metabolic rate of that neuron means it's going to have to make more ATP. Okay, and what I'm saying is if you drop the oxygen and glucose delivery, you're going to have a hard time meeting those demands. If the gap gets too wide between metabolic rate of that neuron and the oxygen and glucose delivery, that neuron will just die. It'll go into apoptosis. And so I noticed that there are things that inhibit mitochondria. And you won't find any of them in a book, not a single one in a medical school book or college biochemistry textbook. I own about 7 of them, okay? But then when I started going through the papers, I quickly found 50, then 60 of them, all right? So let's say you take a statin. Guess what? A statin inhibits mitochondria. So you can't make ATP as much as you would, so you have less energy to pump the calcium out of the cytoplasm, meaning you're more predisposed to excitotoxicity, overactivation in that neuron. Okay, there's tons of things like this. Selective serotonin reuptake inhibitors, antidepressants do that. Haldol does it. Antipsychotic medication does that. Metformin, a very common diabetes drug, that does that. Tylenol, a very common drug, commonly used drug, does that. Aluminum, commonly put in tap water. So there's a whole bunch of common things. Fungal inhibitors, like and food dyes that are in the processed foods, because a fungal inhibitor means a mold inhibitor. So anyways, there's a whole bunch of things dropping your ATP production capacity. So what that's going to lead to is an overstimulated neuron. And if you couple that with a high-fat diet and a high-sodium diet, you're vasoconstricted with thick blood, you're dropping your oxygen glucose delivery, and you can't make ATP because your mitochondria is inhibited. Sooner or later, that neuron is screwed. It's just going to die. And that's what I see. I see all these shrunken brains.
I love everything you're saying here, and it's so great to have somebody with your knowledge on here. I know you focus on the brain and the images of the brains a lot, but let me ask you about osteoporosis, because when you take a blood test or a bone density test, it's always compared to what the average is. So if somebody, they're comparing the numbers of what's normal ranges to the average. So if somebody who's like a vegan, if their numbers are on the lower side, well, we have nothing to compare it to say if it's good or bad. So if a vegan has lower bone density, does that necessarily mean they have osteoporosis or osteopenia, that it's a bad thing, or is it just based on what the world does and says?
Yeah, I think unfortunately a lot of these tests are set up designed to sell stuff. And what I mean by that is the bone density test typically is a comparison with the bone mineral density of a 30-year-old woman. Well, she's of childbearing age, so she needs more bone mineralization to give it to the baby in her breast milk, okay? But a woman who's postmenopausal, she doesn't need to be carrying all that weight around. Our ancestors worried about starvation, so they're not going to carry something around in their body if they don't need it. And one thing I thought was kind of funny was the Bantu women of South Africa. They would typically have, they don't got birth control. They would typically have about 10 children, and they would nurse them typically for 2 to 4 years. And they would get very little calcium during the day, about the equivalent of like 1 little cup of milk. They had no problem with osteoporosis. So what I'm trying to say is, who gets osteoporosis? Little old white ladies who drink milk, okay? And what's thought to be the mechanism, the increased amount of acidic amino acids in meat, it's got more methionine and cysteine, the more sulfur-containing amino acids, part of their metabolic changes before they're excreted from the body, their waste product, is to convert them into sulfuric acid, a certain amount of them. And that leads to buffering. And when you buffer, the kidney simultaneously excretes calcium and hydrogen protons. So it's excreting the urine. That calcium, some of it comes from the bone, some of it comes from the muscle, but you're still excreting calcium from the body. Okay, so what I'm saying is it's the high amounts of acidic animal protein that are predisposing to osteoporosis. It also predisposes to kidney stones, which can be a big pain in the butt. And that also simultaneously leads to kidney failure, because you're destroying kidney tissue from the stones, and the same diet is atherogenic, causing atherosclerosis. So I think it's more of a non-issue. That's not the problem. The problem is stop eating the meat.
Got you. So 2 more questions, 2 more topics here. One of them is the water. What type of water do you drink?
I drink reverse osmosis filtered water. And I do that because tap water, I think, is full of a lot of bad stuff. It's too expensive from a municipal tap water point of view for them to do even carbon filtration. So you get all these estrogenic chemicals in the water. Like one woman, she's taking a birth control pill. She voids it into her toilet. It ends up in the water supply. It comes back in. They don't even filter that out, okay? That's number one. Number two, they routinely put, fluoride in there, okay? They say it's for the teeth, but it's actually kind of a stupid thing to do. In addition, there's chlorine in there, which is a sanitizer. They're both halogens in the vertical column of the periodic table of elements. And halogens in general, they kill stuff, okay? You prep the patient's skin. You used to use iodine, another halogen, and nowadays we use chloroprep, the chlorine. Okay, so they're relatively toxic substances. And so you're ingesting these toxins. They're associated with lower IQ, the fluoride is. And guess what? They put aluminum in there too as a clarifying agent. Even though it's a metal, it sort of binds to other particles and makes the water more transparent. So it's a clarifier. But it's not only forms complexes with aluminum and increases traversal across the blood-brain barrier to increase the risk of lowering IQ and brain damage, but it's also a metalloestrogen, increasing the risk of estrogenic-like cancers like breast cancer. So it's stupid. You don't want that. And the way you got to remove it is you can use reverse osmosis, you can use distillation, and there's some newer techniques that I'm not quite as familiar with, like ion exchange, but I don't know those filter systems that well.
Sure. So what about things like spring water? Why did you choose RO water over spring water?
Well, if I was going to buy like a bottled water, I would want to make sure I would prefer it to be in glass. They don't usually put it in glass though, because glass is so heavy, the cost would go up for shipping.
Sure.
But you're better off with it in glass. Phthalate's a typical bottle made out of that, or even BPA. They got some estrogenic effects to them, and you
Sure.
know,
But the question is, why do you choose a spring RO water over spring water?
well, I just have reverse osmosis of a well, and because I want the
Got it.
RO, yeah. What I do is you take something, it looks like a pen, and it's for checking TDS, total dissolved solid. You just put it into the water and you check the number of particles. So let's say tap water is going to be in the ballpark of like 500 particles per square centimeter, per cube centimeter. Okay, then if I use a carbon filter, I'll be in the ballpark of around 200 particles per cubic centimeter. If I use a reverse osmosis, it's anywhere from 10 with a new membrane to about 110 with an old membrane. If you distill it, it's 0 to 2 particles. So the downside of filtering it much more is that it now becomes hypoosmolar. And if you drank a whole bunch of that at once, you could get headaches and stuff because you're too hyperosmolar. Your blood's about 300 particles. Your osmolarity, which is not exactly the same as TDS, but for all our purposes, it's essentially equivalent. So what I'm saying is, once you RO something, you'd have to be careful. Like you wouldn't want to give a baby a whole bunch of reverse osmosis filtered water. The kid would become hyperosmolar and get sick. So what I would do is I always eat food first when I drink the water. And I don't even drink much water because plant foods tend to be so wet anyways. There's lots of water in these fruits and these salads, and even the starches are pretty wet.
Sure. It's interesting you say that because I have a 2-year-old and I give him RO water all the time. Are you saying you can give a baby too much RO water, or you talking
Yeah, I
about
would not give them too much. Just because I'd be concerned. Water is absorbed very rapidly. Some people will take a lemon and they'll squeeze the lemon into it just to get a little bit of particulate material in there. Because you wouldn't want them drinking a big thing of water because there's nothing in there. There's no sodium. There's no other ions in it. With the RO, there's very little. So I would think it's better to do that.
So what about distilled water? Same thing?
Distilled water is even worse because distilled water has 0 to 2 particles per cubic centimeter. So I would worry about that. Now, I know some people give distilled water. There's a pretty famous place up in California, True North, where they do these water fasts, and I believe they give the patients distilled water. So I don't know what their experience is. They're obviously real competent guys who've been doing this for a long time. And there were some other pretty famous water experts. There was a guy by the name of Yeo Mamas, this biochemist who wrote several books on water, and he would recommend distilled water. All I can tell you is if I drink distilled water, if I drink reverse osmosis water, I get headaches, okay? And there's a hypomolar issue, and there's such a thing as called water intoxication. You look at these marathon runners where they're drinking water every 500 yards. If that's all they drink is water, some of them pass out and have seizures and stuff. And it's a hypoosmolality issue. You're pushing all this non-osmolar fluid into your blood. You're going to potentially have particle shifts because your body's not made for that. Our ancestors cupped their hands together and took a little water out of the stream. That had particles in it.
But those particles aren't necessarily good.
Well, yeah, I RO filter it because I want to get the junk out of it. Because in the modern water supply, there's all kinds of stuff you don't want. So I think it's advantageous to use reverse osmosis and get all that stuff out of it. But the way I would compensate for that is by eating first, or like I said, squeeze a lemon or something into it. Just because I wouldn't want that TDS because and I'm aware of it, so I wouldn't drink that much of it. But I can remember when I was a kid, I played sports. You're all sweaty. I'd come home and I would drink the water. But when I was a kid, we drank tap water. We didn't know any better.
But you get a headache now when you do RO water?
If I were to drink a big thing of RO, yeah, I would. And I think that's exactly the reason, because of hypoosmolarity.
Okay, and so okay, interesting. So distillation that takes out all the impurities, or pretty much most of them, even more than RO. If somebody did that and added some lemon juice or a little pinch of sea salt, you think that would be the cleanest water somebody can get?
Yeah. I would be careful about the sea salt, not too much. I would study that to make sure you knew what you're doing, because just putting too much sea salt in it, that could be a problem too. But I would recheck it, with the TDS, and the lemon sounds better than messing around with salt. And like I said, by eating first, I kind of that way get the body, the whole digestive system going with a lot of particulate material.
They also sell some mineral drops in the store that people put in their distilled water sometimes. I don't know if that's valid or not.
Yeah, I don't know either. I know most people, because they tend to eat, a SAD diet, standard American diet with very little plants. They tend to be deficient in magnesium, deficient in potassium. So if they got good kidneys so they can excrete the potassium well, that's what we need more of. But what I would do is just eat the plants.
Sure. And then last question here is the worst or the most common drink, and I think creates so much of a problem. Tell me if you agree or disagree, is the legal drug coffee. What's your opinion about coffee?
Yeah, I think coffee's for chumps. I think it's BS. Okay. And the reason I say that is I spent quite a bit of time studying excitotoxicity, and caffeine is an excitotoxin. It basically elevates the same hormones of psychological stress. It increases cortisol and increases catecholamines. And those increase glutamate release from the presynaptic neuron, which travels across the synapse, and it's an excitatory neurotransmitter, increases activation of the postsynaptic neuron. So that's the definition of excitotoxicity, to increase activity of the postsynaptic neuron. Well, you don't want to be doing that for no reason. And caffeine's even worse than that. I think it opens up some calcium channels on the endoplasmic reticulum in neurons called the ryanodine calcium channels. So it increases even more the cytoplasmic calcium. Sleep deprivation does that. Psychological stress does that. Corticosteroid medications. I wouldn't want to add to that. It also increases the likelihood you're going to have insomnia, okay, some sleep deprivation. So then you get up the next day, you're tired. What do? You drink more caffeine, and now you've got a vicious cycle going. It's causing insomnia. You're treating the insomnia with the caffeine. It's causing it. So it's not good. It increases blood lipids, so it'll increase your predisposition to make your blood a little more prone to clotting. It increases the urinary excretion of magnesium. Most people are magnesium deficient to begin with. It also increases some calcium in the urine, increases the risk of kidney stones a little bit. I think it's totally overrated. People do it because it's like the cool thing to do. They'll see the older person doing it, and then the younger person wants to be cool like the older person, so they start doing it. And then it becomes a habit. It's addictive. You get a withdrawal headache from vasodilation, so you start doing it. It's also a vasoconstrictor. It's a cerebral vasoconstrictor. It decreases blood supply to the brain, especially the frontal lobe. So that's the last thing I would want.
So some people say, oh, everything's good in moderation. So how dangerous is it or bad is it for somebody to drink 1 cup of coffee a day, in your opinion?
Well, 1 cup a day is not that much. It's not that bad. But I also think what happens is the older we get, the more fragile we get. So I think the older you get, the more you should try to optimize all your habits. Plus also, you've got your baseline of health. And sometimes, bad things happen to us. We get sick with whatever it is. We fall down, we break a bone. And you want to maintain like high health as much as you can. So when something bad happens to you, you got the resilience to heal yourself, to recover. The more you start becoming fragile and sick and weak, one big event, let's say you get in a car crash, let's say you fall and you break a bone, whatever, the harder it is going to be for you to turn that around. So I try to maintain a pretty high level of fitness. And what I'm saying is, why would I want to do anything that's bad for my health? I only want to do the good things. I don't want to do any of the bad things. And so, I used to drink caffeine in the past, but once I studied it and I read more about it, I read that book, Caffeine Blues. I read a bunch of papers on it. I studied a lot about cortisol, excitotoxins. I'm like, hey, this is stupid. I'm not doing that anymore.
So just clarify, so everyone's clear on this. You're not saying 1 cup of coffee is good. You're saying it's not as bad as 2 or 3 or 4 cups of coffee.
Exactly. It's not that big of a deal. It's much worse to be eating meat and oils, but it's like, why do anything that's bad for your health and stupid?
Exactly. Well, this has been wonderful, and thank you so much for taking the time. How can people find out more about your work and what you're doing and your books? Do you have a website they can go to?
Yeah, I have a YouTube channel, Peter Rogers, MD. I make videos there, and I've written a bunch of books. Probably my best book was The Medical Reformation, where I kind of pointed out, like I just said, all these medical textbooks, they're wrong. They're like a joke. They're stupid. And that's why conventional doctors don't know what's going on, because they don't know the most important things. I call my mnemonic NETs. Nutrition, epidemiology, toxicology, and then the S is all that other stuff like sedentary versus exercise and whatnot. So they don't know the things that actually cause disease. And because they don't know what causes disease, they don't know how to help the patient get better. And it kind of becomes a little bit of a joke, just selling drugs.
Yes, well, I'm going to put your link below, everybody, to get to his website and check out his books and his links. So let me ask you, is it true that the number 3 cause of death is mistakes by doctors? Is that true?
That's what I have heard. Now, I don't know for sure if that is true, but I have heard some papers suggesting that. And of course, it's always going to depend on how you look at the data. But I think the biggest part of it is what I would call, let's say we were talking about economics, the opportunity cost. Basically, these are people who, almost all of them is the same thing. They're fat, they're hypertensive, they're pre-diabetic, diabetic, and then that causes atherosclerosis, plugs up artery all over the body. They become cognitively slow and stupid. Now it's all irreversible. Dead. Okay. And so what I'm saying is they have the opportunity to cure these conditions before they become irreversible, but they don't realize it because they're under the impression that the only option is take these pills. So that's the opportunity cost. They could have gotten better, but they never do. Most patients, they never get better. They just progressively crash and burn.
Sure. Well, thank you so much for taking the time tonight to talk to us and share all this knowledge that you've gained over the years. And if anyone has comments or questions, please post them below. And hopefully we could have Dr. Rogers back on again to address some of those questions. But thank you for your time. Is there anything you want to add before we finish?
Well, that's pretty much. Oh, well, I do think these also are causing psychological effects. I think they're contributing to people feeling anxious and whatnot because these stimulants are overactivating their brains and they don't even realize it, but they're ingesting these chemicals that are increasing the neurotransmitter activation in their brain. Like, for example, glyphosate, the stuff on the non-organic food, it's also an excitotoxin. It increases calcium passage through the NMDA receptor. Okay, so these are overactivating the neurons. I think that's causing people to feel anxious and they don't even know why. So when you optimize your diet, and you'll see vegans have much better self-control than all the paleo keto carnivores. You see how they behave on the internet comment sections. And I think that's why. I've actually been studying that and I'm working on writing a book about the biochemistry of mood disorders.
Do you think a junk food vegan diet is just as bad as let's say I don't know. See, all the diets out there have some sort of success because they have something in common, and that is they're leaving something out. So standard American diet is much worse than even a paleo diet because they're leaving something out. And people are trying to care about what they're doing a little bit, but they're not necessarily good. But if you had to compare a junk food vegan diet with maybe a so-called not as bad meat-based diet, do you think they're comparable, or do you think the junk food vegan diet with very little fresh food and a lot of fake meats is better or just as bad?
Yeah, you run into a lot of problems. The more you process a food, you take out all the fiber. Then they throw in all these preservatives, which are quite toxic, like these fungal inhibitors, mold inhibitors. They're mitochondrial inhibitors. They're pretty toxic. All these food dyes, they tend to be mitochondrial inhibitors. And there was a guy by the name of Feingold, wrote a book back in 1972, The Feingold Diet. He took all these kids with allergies and attention deficit. He put them on, these simple foods, and tons of the kids got better. So I think the processed food is really bad. It makes people fat and sick and causes all kinds of problems.
Wow. Thank you so much for your time, man. And everybody get to his website and look at his books and great information. There's a lot of videos on his YouTube channel. Check that out because that's how I found Peter Rogers and good information. And so check them out. I'll put the YouTube channel below. Dr. Rogers, thank you again for your time and keep up the great work.
Nature's wealth, good for your health. This is the Raw Life Health Show.